Hello, wonderful students. Myself, Dr. Maddineni Srinivas, dermatologist from Bharat, India. I am making videos which are important for the theory exams for MBBS students. So I have already made so many other videos. You can check them out. The link for the playlist, it is available in the description. Also, I will keep it in the comment section. So these were all the topics which I have already covered. And in the today's video, what are we going to cover? It is erythema nodosum, clinical features, diagnosis, and the treatment part. So, getting into the topic directly, erythema nodosum. So, remember, it is a panniculitis. What is erythema nodosum? It is a panniculitis, specifically septal panniculitis. What do you mean by panniculitis, sir? You may be asking. So, remember, in the skin we have epidermis followed by dermis and we have hypodermis. Hypodermis is also called as panniculus, and if there is inflammation of this hypodermis we call it as panniculitis. And remember, there are two types of panniculitis. One is septal panniculitis and the other one is lobular panniculitis. Depending upon if the fat lobules are getting inflamed, we call it as lobular panniculitis. If the septa, which are separating these fat lobules, is getting inflamed, we call it as septal panniculitis. And erythema nodosum is a septal panniculitis. Okay. And it is often associated with delayed hypersensitivity reaction to various antigens. What are all those various antigens? Okay, the causes could be mostly erythema nodosum is idiopathic. Idiopathic is we cannot identify what is the reason or what is the antigen associated with erythema nodosum. Approximately 50% of the times it is idiopathic. And we have next infectious causes, out of which you should remember the streptococcal pharyngitis is the most common identified cause. Followed by there are other infections also, like for example Mycobacterium tuberculosis, Mycobacterium leprae, Yersiniosis, viral infections like HIV, and infectious mononucleosis and hepatitis. Fungal infection like histoplasmosis and coccidiomycosis. All these could be associated with erythema nodosum. And also systemic diseases are also there, which you can remember as sarcoidosis. You might remember multi-system disease. Okay, and inflammatory bowel disease, Crohn's disease, ulcerative colitis, and also it can be associated with systemic lupus erythematosus and certain malignancies like for example Hodgkin's lymphoma, pregnancy, and there are certain medications like oral contraceptive pills. Okay, these are the important causes which you need to remember related to erythema nodosum. So you are already preparing for your final prof, so you might be coming across all these diseases, and you might have heard that erythema nodosum is one of the manifestation of those conditions. Now coming to the clinical features of erythema nodosum. So it is most commonly seen among the individuals who are in their 20s and 30s, but it can occur at any age. And women are more commonly affected when compared to the male. Lesions. What are the lesions which you are going to see characteristically? Yes, now this is important to remember. There will be very painful, tender, red colored nodules which are present in the hypodermis. So subcutaneous nodules which are erythematous and tender are going to be the classical picture in the erythema nodosum, and most commonly the location is going to be over the shin, anterior aspect of the leg. Rarely it can be present on other areas, but for your purpose, remember shin with erythematous tender subcutaneous nodules is always erythema nodosum. Okay, and lesions last about 6 weeks and heal without any scarring. There will not be any scarring, and it is going to have a problem that it is recurrent in nature. It is a recurrent condition, and the patient is not only going to have just the skin lesions, but they are also going to have the fever, malaise, arthralgia. So constitutional symptoms will also be present in the patients of erythema nodosum. And clinical, primarily it is based on the clinical presentation. The diagnosis, just with the help of clinical picture we can come out to a conclusion. But you can also send for blood investigation, where because there can be associated infection which is underlying cause for erythema nodosum. So there could be the picture which is showing like that of an infection. So elevated ESR, CRP, and you can also see, because it is streptococcal pharyngitis which is the most common cause, so ASO titers, MAN2 test. So you can just remember the cause and write down what investigation you want to do pertaining to that cause. That will be okay. if you happen to do a biopsy histopathology, it is going to show inflammation in the septa of the subcutaneous fat. Okay, so yeah, there are few slides regarding management, but before that, just if this video was helpful, please do like this video and also do subscribe so that you will not forget to subscribe to get this type of awesome content on a regular basis. So what are the general principles of management of erythema nodosum? So it is a self-limited condition. We can explain the patient that yeah, this can reduce, so do not worry. Okay, that is one of the option, but usually we are going to treat the patient. Identification and treatment of the underlying cause is very very important, because if underlying cause is taken care of, then the erythema nodosum slowly it is going to reverse. So symptomatically, what treatment are we going to give? So rest and elevation of the affected limb, that this is very important whenever there is any inflammation happening in the body. Non-steroidal anti-inflammatory drugs to reduce the pain, fever and also arthralgia can be given. Just remember potassium iodide. Potassium iodide is also one of the treatment option for erythema nodosum. And apart from the, to reduce the inflammation, corticosteroids play a very significant role if the condition is severe or if there is extensive disease. But remember, if the cause is any underlying infection, then this should be avoided, because corticosteroids are going to reduce the immunity, so there is going to be even more proliferation of the infectious agent. So we should always identify what is the cause, and then only we should jump into the treatment part. Next, avoid systemic corticosteroids in patients with infection. This is very very important. And chronic or recurrent erythema nodosum may be treated with medications like colchicine, HCQs. Okay, just remember the names: colchicine, hydroxychloroquine, HCQ. Okay, so that's it in this video. I hope this was helpful. If it was helpful, please do hit that like button and also do share this among your friends and try to do group discussion about this topic, and yeah, then it will become very easy for you to remember this whatever topic you have discussed in the final actual exam. Okay, and which topic do you want me to make a video next on, secondary syphilis or rosacea? Please put your answer in the comments, and I hope this video was helpful. So if it was helpful, please do hit that like button, also do subscribe, share and comment whatever you felt regarding this particular small short video, and any other suggestions. So thank you so much. We'll meet you in the next video. Till then, happy learning. Sarvam Sri Krishna Arpanam, Sarve Jana Sukhino Bhavantu. Thank you so much.